Hello, yeah, I'm back again. This is continuation of our topic on infertility. But my dear, there is no problem that doesn't have solutions. So even if you're battling with infertility, sit by and watch me discuss on the solution. Yes, there is good news. There is always a solution to every problem. So for couple that are battling with infertility, there are treatments to that. For a woman, there are treatment. For a man, there are treatment. So you have to visit a good gynecologist to check for whatever that is the cause of your infertility. The first step of solving a problem is knowing the cause. So when the cause of your infertility is discovered, the medical expert will know how to go about it to find a solution for you. So the first step you need to take is to visit the hospital, consult a gynecologist, consult an expert to guide you properly on what to do. Yes. So if it's infection, the infection can be treated. If it's low sperm count, medication can be given to boost your sperm count as a man. If it's a low motility, there are drugs for that. Yes. So if you're a woman and you've been married for 6 months to 1 year and you actually want to conceive and conception is not forthcoming, you have to visit the hospital. And as you visit the hospital, please don't go alone, go with your husband. That's the wrong impression our African men have, that our cause of infertility in marriage is attributed to to the women, to the that's the cause of infertility is from the women. Is very wrong. Is a very wrong ideology. Don't let me bite my tongue. It's a very wrong ideology. In a family that experiencing infertility, it could be from a man, it could be from a woman. Yes, research have shown that 40% of infertility is attributed to a woman, 40% attributed to a man, and 10% is unknown, while 10% is 20% is unknown. Yes, so it's either the woman is infertile or the man. So if you are married and your wife have not been able to conceive, don't push it to the woman. Don't say is the wife is my wife. No, and don't say you have to go to hospital and check yourself. No, if you want to help yourself, go with your wife. Go to the hospital. You might be surprised to discover the cause of infertility or the cause of childlessness in your marriage is from you, the man. So don't blame the woman, and the woman don't blame the man. Both of you should go to the hospital and check for the cause and then seek for remedy. And I trust God will come true for you when you're seeking for a solution. Because in this life, whatever you are doing, you just have to be asking for the help of God to help you. Because if He helps you, things will be easy for you. So even if you are infertile and you meet a health expert, and the health expert take it upon himself or herself to see you through, to provide a solution. When God comes in, the solution will come fast, the solution will be effective. So I want to, beside going to the hospital, I want to give us three, not three anyway, like let me say five treatments for infertility. Number one is after medication has been taken and there is no improvement for natural conception, couple can try one IUI. What is IUI? IUI is intrauterine insemination. Let me write it. Intrauterine insemination. This intrauterine insemination, health expert, health experts, provides a sperm, and that sperm is directly injected into the woman's uterus. Yes, for instance, if a man has a low motility uh for for impregnating the wife, this remedy can be used. That's because the cause of that childlessness in marriage, if for instance is because of the man's low motility of his sperm, IUI can be used to directly take the sperm and inject it directly into the woman's uterus, and the woman will conceive. That's if is the man's sperm that is the problem, maybe the motility. Then number two is IVF. We are popular with this IVF. IVF is bringing the woman's egg, bringing the man's sperm, putting it together in a lab tube, uh, putting it, and then when the embryo becomes of the should I say becomes of age, you know what I mean? Like bring a woman's egg, extract the woman's egg, harvest the woman's egg, bring the woman's sperm, put it together in a lab, and then make embryo grow. Embryo, that's the, let me not call it baby. Embryo is the lower version of a baby. Make it grow. So when it grows, it is now put in the woman's. It is now implanted. Let me be using a. Let me be using hertz. Sorry. So okay, what was I saying? Why am I distracted? So it's the it will not be implanted inside the woman's uterus. That's IVF. Bring egg, bring sperm, put it together in the lab. When it forms the embryo, it will not be implanted in the woman's uterus. That's the second treatment to infertility. Then the third is ICSI. ICI is let me write it. I ICSI. ICSI. This procedure is similar to IVF. Yes. An embryologist, that's a highly specialized lab technician, directly, injects a single sperm into each of the harvested eggs, and then a health provider transfer the embryo into the uterus. Do you understand it? The Let me stop writing and concentrate. As if I'm in a classroom. I'm also a teacher. So that's why when I'm talking, I want to be writing like as if I'm seeing people in the classroom, but that's by the way. So that's the second treatment. And the third treatment is the third party acts. That's assisted reproductive technique. Yes, if for instance couple uses a donor, a couple seeks for a donor that can give egg, and then it can be used if it's from the woman's side. If the problem is from the woman is not able to produce an egg or a mature egg that can give conception, the couple can look for a donor, a woman that can donate a healthy egg for production. Yes. And if the man too is not able to impregnate a woman because of a low sperm count or whatever reason, the couple can also seek for a sperm donor. Yes, that's a third party act. That's you seek for assistance from a donor, either for egg donation or for sperm donation, or to also seek for surrogate mom. Yes, surrogate mom. Then the third is a sperm wash. Yes, health expert gets the sperm of a man, washes it to purify it, to remove the dead sperms, to find a way to boost it. And then when that is done, they can use it, put it in a after washing it, remove dead and abnormal sperm before using it for fertilization for IVF. Yes, because um sperms can be treated when taken to lab. They will wash it, remove dead and abnormal sperm so that the sperm can be used to fertilize maybe an egg from a donor, or fertilize the woman's egg directly. So these are ways to get children. If you have tried medications and they are not working, you can seek for alternative of IUI, IVF, ICSI. I introduced them and I explained them earlier. Um, Third party act, looking for an egg donor or a surrogate mom, or a sperm donor too. Yes, or the man's sperm being washed in the lab so that a abnormal sperm can be removed. Then I want to give us about 10, 10, 10 points to prevent infertility. Number one is eat healthy. Yes, make sure you eat balanced meal. Eat healthy so that even if you are having issue with maybe hormonal imbalance. There are food you will eat and it will boost your hormone. If you have a low immune, there are food you will eat, it will boost your hormone. Yes. So number two is let me write it. Number two, don't smoke too much. No, stop smoking. Yeah, smoking is not good. Even it's written on the pack. Smokers are liable to die young. So why are you smoking? What's the health benefit of smoking? Is it for a fizzy? Are you doing things to please people when your health is at the receiving end? No. Cut off smoking. Yes. Third is minimize or stop alcohol. Alcohol weakens the sperm count. Yes, especially if you are battling with infertility. Alcohol will not help your sperm. Instead, it will reduce the sperm. To reduce the sperm. Number three, okay, I've mentioned one. Number four, right? Number four is treat sexually transmitted disease. If you have STI, sexually transmitted infection, sexually transmitted disease, SDT, treat them. Yes, they causes infertility. High time, they cause infertility. Treat them. Then reduce exposure of yourself to radiations, to toxins, to chemicals. Like for the men, don't always sit for too long. Don't always put phones in your trouser pocket, because if you do that, the radiation can be transmitting to your reproductive organ, your scrotum, you know what I mean. Don't mind me. So, and another point is cut down on stressful activities. Cut down on stress. I've talked on stress. Stress is not good, it's not healthy. It can also affect your stress level. Yes, then avoid unexposed sex, because unexposed sex will expose you to STIs. Yes, please. If you are married, stay faithful. But if you are not married, abstain. But if you can abstain, use protection. Yeah, because I won't be there when you want to do it. That's why I'm telling you. I'm not saying you should do it, oh, but if you must do it, use protection. Yes. So this is where I want to pause so that I don't make this video too many, like I made in the first my first five videos, which I treated liver. So many people, this recent age, people have been suffering from liver problem. Sorry, kidney and few liver. So okay, sorry, it was kidney I treated. One day I will also treat a liver problem. So I have about five videos for that. So let me not make this one like that. So I'm pausing here, and I hope you enjoyed the video. I hope you've learned so much from this exposition on infertility. So on this topic, I've rounded it off. So please send the videos to your loved ones that are suffering from infertility, and tell them that there is hope for them. There is solution for every problem. And if you're the one watching me, there is solution to every problem. There is no problem that is permanent. So don't worry yourself. Seek for help, and God will help you to get help. Thank you for watching my video. I love you. Bye.